So what we're aiming to do is just to give you a general introduction about Ladybug House and what we do, and what your first, couple of sessions might look like, and what therapy looks like with us. So firstly, we'd like to acknowledge the traditional owners of the land on which we're meeting. We pay respects to their elders, past and present, and the Aboriginal elders of other communities who may be here today. So who are we? Some of you might know who we are, some of you might not know who we are. So we're a team of speech pathologists and occupational therapists. We have 2 locations, one location in Melbourne and one on the Gold Coast in Queensland. Our vision has been this for a number of years, and that is to empower parents to become self-reliant. So what we mean by that is that we are the trainers that train you as parents, so that we can give you the skills to teach your children in your day-to-day lives, because you're the ones that spend the most time with them. You might see us once a week or once a fortnight, but the rest of the time we need to be providing you the skills so that you can make the difference to your children in their day-to-day activities. Our values at Ladybug House is something that we hold quite close to our hearts. We call ourselves a big family. So our values are values that might resonate with you as parents and as, family members. So our values are respect, courage, and passion. So our passion to provide you or our families and your children the best possible assessment and intervention that we can. To have the courage for us to try new evidence-based intervention approaches, and to give you the courage to try those skills at home that you need to build in your children. And the respect that we have for each other as colleagues at Ladybug House is very important, and the respect that we give you back to, or that we give and have for our families and the clients that we work with. So those are our 3 values. We are very supportive of supervision of students, so for clinical education, volunteers, interns, and other disciplines that come into Ladybug House to learn. So you may see from time to time student speech pathologists or student occupational therapists or volunteers that come into our clinic from time to time that are learning skills or new skills or different skills that they can take with them into the future. We, from time to time, also have maternal and healthcare nurses that come to our centre to do some training and observation. So you might see some students and volunteers hanging around the place.
I might talk to this slide, Maria. I guess I'm one of the speech pathologists at Ladybug House in Melbourne, and we thought we would just give you some information on the areas of practice that we do work in as a speech pathologist. Firstly, as maybe some of you might not know all of the different areas that we can focus on in our role. So firstly, one area that we do focus on is speech. So that would be more so the sounds that your child is using in their talking. So the different sounds that they're using, and if they might have any difficulties pronouncing some of those sounds, but also they may substitute certain sounds for other sounds. So that is just one area that we can work on. The next area that we focus on quite a bit is language as well. So there is a difference between speech and language skills. So language can include how your child understands language. So maybe in directions, can they follow directions? Can they understand questions? but it also focuses on how your child uses language. So the words that they're using, how they put their words together, their vocabulary skills. And these are some areas we will also focus on in our future parent training sessions, but we just want to give you a little bit of insight into what we do focus on firstly today. But in the next few sessions, we will also break this down a little bit more for you as well. Some other areas that we also work on is stuttering and social skills. So social skills or pragmatics can mean things like turn taking and sharing, how your child engages in conversations with other people, as well as feeding and voice. So as speech pathologists, we can work on those last two areas, but those two areas are sometimes areas that we might refer you on to see another speech pathologist, as they can be quite specialty areas where a speech pathologist might really be an expert in that area or have a lot of expertise. So we may refer on to another therapist if there is some challenges around feeding and voice. And so what is occupational therapy? For occupational therapy, you would see an occupational therapist. And again, your occupational therapist can work on a number of different skills with your child. Some of those might be gross and fine motor skills. So gross motor skills being what you do with your whole body. So I guess things like jumping and climbing, and then fine motor skills being more so things that you do with your hands, or handwriting, picking small pieces up off a table, but manipulating things with our hands. But again, in the future sessions that we run, we can break these down into more in-depth descriptions. Your occupational therapist could also work on emotional regulation. So that might be your child's ability to manage their own emotions, but also understand the emotions that they might be experiencing as well. So your occupational therapist might give you some tools to help with that emotional regulation and to cope with maybe some of those bigger emotions as well. An occupational therapist might also work on some sensory processing. So that might be if your child is quite sensitive to different sensory systems. So things like tactile sensory sensitivities. So maybe things like tags on clothing can be sensitive for some children. And just lastly, feeding and eating. So an OT or an occupational therapist would work on feeding and eating skills, as well as some self-care and toileting routines as well. But we will break down both speech pathology therapy and occupational therapy in the future sessions as well for you. That's just a brief summary. We might talk to some service delivery now. So we can offer quite a range of different service delivery at Ladybug House. So you probably are most familiar with more so an individual or one-on-one session with your therapist. And that can be both face-to-face and telehealth as well. And during COVID, we've realized that telehealth can be a really great opportunity for families as well, and to empower families in their home environment. It can be a little bit daunting, but we can really see what resources and things you have in the home that we can really use to help you implement those therapies in your home environment as well. So it's been a really great opportunity to have that telehealth as an option, because I guess it really empowers you to be a part of that therapy as well. We also run pair sessions or group sessions. So we run social skill groups at Ladybug House, and there's some pictures there of some of our groups that we've run as a team. With the group sessions, they're usually run by one speech pathologist and an occupational therapist so you've got both disciplines in that area. But sometimes it might be two speech pathologists or maybe two occupational therapists, depending on what group we are running. We also have the opportunity to run joint sessions. So a speech pathologist and an occupational therapist running a session together with your child. I guess that brings both areas of expertise into the one session. But you could definitely talk to your therapist a little bit more during your sessions if that is something that you would be interested in. There's also the option for outreach visits. So this might be your therapist coming to the kindergarten, childcare. We also do home visits and school sessions as well. So we find sometimes the kids that are at school having that regular therapy in their school setting can really support the educators and the child in that maybe new setting for them as well. And just lastly, case conferencing is also an option. So that might be when lots of therapists that your child sees meets as a team to discuss, their goals and progress and how we can best support them moving forward as a team.
Thanks, Leah.
No worries.
Some of you might, if you've already engaged working with clinicians or therapists, you might already know that we work with other professionals and we can work with them quite closely at times, particularly if the child has more than just us working with them. So we can work with general practitioners or GPs. We can work with paediatricians a lot of the time. We do multidisciplinary assessments with paediatricians and psychologists sometimes, and more specifically for autism spectrum disorder. We work with educators, and educators might be your childcare educators, kindergarten teachers or school teachers, and a lot of the time we work with school teacher aides or teacher aides, because they can be a big part of a child's life. If they're at school and have an aide that works with them, we can do a lot of liaising with that aide. We can work with social workers and also other allied health professionals such as physiotherapists, dietitians, OTs, which we have on site. So we can work with a range of other professionals in the care of your child. So what would you expect at your initial appointment when you come to Ladybug House? So what we would typically do across both speech pathology and occupational therapy, again, it might be something that you've experienced, and every therapist, when we do see a child for the very first time, even though they've had an assessment elsewhere, we still, as a new clinician, need to make our own assessment of that child. So we would start with what we call a case history with you. So that means we would ask you some background questions about the development of your child. So we might ask some really sort of general questions about when did they first start walking, crawling, what was their first word. And sometimes it can be hard for parents to remember, but you would just do your best, and we could try and get as much information as we could. We would then start to do either a formal or informal assessment. And what we mean by formal assessment is an assessment tool or a test. You might know it as a test that usually has, some sort of form of a booklet with pictures on there that we might be assessing their understanding of language or their expressive language, or for an OT it might be they're assessing their handwriting skills or fine motor skills. So that's something that's more formal, it's structured, and it's been tested amongst thousands of other children, and it's been normed. So then we go back and score those tests up, and we can compare the results your child gets against other children in the population. We can also do informal assessment, and sometimes for those really young clients that we see, and they might be 20-month-olds or they might be 18-month-olds or 2-year-olds that can't really attend and sit and focus at a table and chair, we would call this informal assessment, where we would do some unstructured assessment tasks, and they might be just, that might look like you're sitting on the therapist is sitting on the floor playing with your child, but in that time, we're actually doing informal assessment. So we're looking at how the child might be interacting with us, how they might be interacting with you, what sort of language they're using, what sort of not verbal and non-verbal language they're using, and what sorts of things they're interested in, if we've got some toys scattered around. So informal assessment can be very useful to us because we get to see different behaviours or behaviours that we might not see in a structured situation. Sometimes we might do a mix of both. We might do a bit of formal and we might do a little bit of informal assessment. Establishing rapport with you and your child is a really pertinent factor in our therapeutic process. It's an important part because children need to establish that rapport to gain trust from us, and we need to feel comfortable with each other so that the intervention that we do is the most beneficial for you and your child. We also look at starting to establish goals with you in the first session or two at initial appointments, and establishing goals comes from the assessment that we complete from your child. Service agreement is something that we complete with all of our families, and goals are incorporated in your service agreement document with us. Time frame. We get questions from parents like, how long will the therapy last and how many sessions do I need to come for, and will it be for the rest of the year? And this will vary from child to child because every child's an individual and they all have different needs. So sometimes it's really hard for a therapist to inform parents of how long the therapy will need to be because we just don't know how quickly a child will respond with the intervention that they're given. So as sessions progress, you'll be guided by your therapist because what we do is we start to then measure goals as we go in our intervention. So we can say to you, look, these were our goals to begin with. Your child's done really well with this goal and this goal. We're going to move on to this one next and then this one. And then, but by the end of a certain period of time, you will have a better idea as to sort of where your child's heading with therapy. Sometimes we see children for a long, long time, for a number of years, in fact. And that's because every child's goals are different. And then as they develop year after year, we need to re-establish new goals. And so, their intervention will seem like it's going on forever and ever, but we are delivering different interventions along the way to meet those new goals. We will have, you'll have the opportunity to discuss results of assessment if there's some formal assessment that's occurred. We'll give you the results of those assessments, most times verbally. Sometimes parents request a report and the report might be for a specific purpose. It might be because the child needs to go to school and the school's requested a report. It might be for a specific assessment and a paediatrician or your GP or another specialist has requested a report. So those discussion of results would be reported on in a more formal way. We will generally give you a bit of a plan for what to look for, what we're going to be looking at the next session, and so that you're prepared and you have an idea of what you might be coming back for. We're also there to provide answers to your questions.